All right, good evening, everybody.
Good evening.
It is 6 o'clock, so the work session for mayor and council for February 19th is called to order. And Ms. Rainey, can we have a roll call, please?
Yes, good evening, Honorable Mayor, council members, and City Manager, Mr. Clark.
Good
This is the
evening.
roll call for the work session of February 19th, 2024. Mayor Butler,
Present.
Councilmember James.
Present.
Councilmember Anton,
Everybody, how's everybody doing?
Councilmember Gutierrez, Councilmember Akins Wells,
Here.
Councilmember Mears.
Here.
Mayor Butler, you have a quorum.
Thank you very much. Adoption of the agenda. Is there a motion for such item?
So move.
That was Councilman Antoine. Is there a second?
I'll second.
That was Councilwoman James. All in favor? All right, thank you. New business. Presentation on community paramedicine and mobile integrated healthcare. Background and history. EMSC Gelmini will give a presentation on community paramedicine and mobile integrated healthcare and will speak on the differences between the two. Good evening, sir.
Good evening, Mayor and Council. How are you this evening? So prior to this, I was challenged to keep tonight's meeting fun and entertaining, and I was challenged to find a good joke to open with, so I found one. How many city managers does it take to change a light bulb? This topic was resumed from last month's meeting, but is incomplete pending the resolution of some action items. It will be continued in next month's meeting. Meanwhile, we're going to talk about community paramedicine.
Love it. I love it.
Something happened. Big move and everything.
Right. Clearly.
Community paramedicine and mobile integrated healthcare is a topic that's been thrown around a good bit lately in the healthcare community. It's not working. Next slide. It was working before we started. There we go. So we're going to cover some different topics tonight. We're going to talk about mobile integrated healthcare versus community paramedicine and the actual terminology of it. We're also going to talk about a little intro to mobile integrated healthcare because there is a big difference between the two. And I believe that community paramedicine falls under mobile integrated healthcare. We're also going to talk about health needs assessments, the taxonomy of a mobile integrated healthcare program, as well as infrastructure, education that's required, the medical oversight, and then some special considerations in a program like this. Next slide. Mobile integrated healthcare addresses multiple factors in bridging the gap in acute care, home management, education, and follow-up care. So mobile integrated healthcare takes community paramedics and actually puts them with a doctor or a nurse, as well as mid-level providers, to bring healthcare to people's homes. This not only reduces 911 calls, but actually provides the care for these people inside their home for not just chronic conditions, but everyday things as well. Community paramedicine, when it's mentioned in that standalone, is primarily focused on hospital reduction. So they want to reduce 911 calls as well as reduce readmissions to the hospital for chronic conditions, not specifically to bring care to the community. You can go to the next slide. So information needed to start a mobile integrated health program is the population's needs, starts with the population needs, and this is done through a population survey. So what are the health needs of the community itself, and what are the service gaps that we see as a community? Also involves a lot of input. What do we invest into this? Who are our stakeholders and who are our partners? As well as title, what do we do? Who do we reach out to? And then outcomes, what are the results expected and how and when do we measure these results? And then how do we put together a team of providers to provide the care that's needed? Who do we employ and what's the licensing and education? Next slide. Health needs assessment is the best assessment tool for painting a picture of what is missing in the community that can likely be filled by a mobile integrated program. If you have an influx of doctors that treat a specific condition in a community, that's likely not something that will need to be provided by mobile integrated healthcare. But what kind of gaps in healthcare provisions are needed in a community for us to provide with those physicians and interfaces between physicians and paramedics? It's the best assessment to tell a collaborative effort among diverse healthcare providers. So this allows for community paramedic and MIH programs to get together and bring those providers into the community through the mobile integrated healthcare program by making the paramedics and the mid-level providers in that program the mouthpiece for those doctors and treatment plans for them to be in our community without necessarily being in our community. And is also a comprehensive assessment of the community to determine the outcomes of how a mobile integrated healthcare program would benefit. This helps with answering the questions of what are our target populations, goals, and barriers that might be seen to a program, as well as identifying resources such as physicians, mid-level providers, nurses, and specialty care doctors that would be able to provide assistance. And also is needed to profile the population on what the population actually wants, what kind of healthcare problems they are having, and what their current health status is. Next slide, please. When it comes to mobile integrated healthcare, there are 4 main taxonomies. Most of the time, your programs follow one of these taxonomies in order to provide the best care for the community it's reaching. The patient navigation is designed to provide a patient with the right services for their needs. This is where your needs assessment is imperative, to where you can see what kind of healthcare is not being provided to the community and would benefit through the mobile integrated program. This reduces the reliance on EMS and 911 and reduces the reliance on emergency departments for small things like headaches, abdominal pain, things that a general provider could treat. Adjunctive mobile care is designed to fill gaps in available healthcare needs as well, and reduces reliance on hospital usage for routine medical care. This is the ones where you see that you actually have mid-level providers that are providing prescriptions in the field for low level to keep people out of the hospitals. The second 2 types are primary types that we probably would not be able to provide as well. This is occupational and community health services. This is designed to focus on absentee reduction and workplace safety. Injury assessment, drug and alcohol screening, as well as injury prevention fall under this taxonomy. And then medicine in underserved and austere environments is designed to focus on providing primary medical care in underserved remote communities. Next slide, please. The infrastructure of a mobile integrated health program, you have to have a professional workforce. This workforce includes EMS providers, mid-level providers such as nurses, nurse practitioners, and physician's assistants, physicians, community health providers to assess the community health needs, as well as pharmacists that would be willing to provide pharmacy services to these patients, home health providers, hospice providers, nutritionalists, and then data analysts to sit back and analyze the data of how the program is succeeding. Other support needed would be medical direction. There has to be a physician that oversees the entirety of the program. Strategic partnerships with the doctors and facilities that are mentioned, the hospitals included. Training and education resources in order to educate our providers to bring them up to the level of community paramedic. Communications resources, such as ways to get in touch with mobile integrated healthcare outside of a 911 call. Mobile resources and transportation, which is primarily why you see community paramedic and mobile integrated healthcare fall under the fire department, as we have the mobile resources such as Tahoes and ambulances available for that use. Sustainable funding, as well as evaluation and measurement tools. Next slide, please. Due to the complex interprofessional design, the education is focused on gaps in initial education and training fields needed for the program. Taking a paramedic and then taking the needs assessment of the community and having that outlay what kind of training is needed in order to provide the medical care that's needed for a community. The IBSC, which is the International Board of Specialty Certifications, does offer certification in community paramedicine. There are also college education certificates as well. Courses are provided face-to-face, remote, online, synchronous, and asynchronous, as well as through lecture discussion, demonstration, modeling, and clinical training by physicians. Next slide, please. Medical oversight would be needed by a physician. The responsibility of the medical oversight would be the scope of practice, to teach and train and control the scope of practice that would allow us to do the procedures needed to meet the needs. Licensing and credentialing oversight to make sure that all of our providers had the appropriate license and credentialing and education and background to do these jobs, as well as hold the legal responsibility for the practice, know the needs and expectations of the community as well as the governing body, to know the funding models and reimbursement models, and then the regulatory oversight. Qualifications for this position would be a physician with experience in out-of-hospital and mobile healthcare. They must partner effectively with other local medical resources and advocate before policymakers and other officials for the mobile integrated health program and services provided. They must be able to communicate well with diverse audiences, and they must be able to develop, measure, evaluate, and report on program measures. Next slide, please. Some financial and legal and political considerations to be had. Financial is the cost of service. Cost of service with a mobile integrated healthcare program will vary based on the size and scope of the program. How does it look long-term and sustainability? There is no standard model for program funding, and reimbursements are still in the works for Treat at Home on 911 providers. I can tell you right now that Medicare is looking at, but they are not currently funding Treat at Home measures. Some of your insurance companies do offer some reimbursement for Treat at Home, but most don't match the actual cost of the equipment used in those circumstances. Legal and political considerations, scope of practice concerns. We are held to a state scope of practice as pre-hospital providers, and that scope of practice may have to be broadened with permissions and under the medical oversight of a physician in order for some of the tasks to be carried out by paramedics. Opposition of existing local resources. If a physician's office is against this program due to the possibility that it might cut down on their patient load, it is something that we could see opposition from, as well as HIPAA compliance with healthcare information. We have to keep and make sure that all of our records are kept and maintained and transported within compliance of HIPAA, as well as billing expertise with mobile healthcare experience to allow for the most in reimbursements to come from these insurance companies. And then the need for legal counsel dedicated to support the program. Next slide. Evaluation measures. We have to look at the operational performance. How is it performing? Healthcare quality. Is the community receiving the quality of healthcare that we expect them to see from these providers? The total cost of service and the overall evaluation based on program data. The ultimate goal for this program would be better healthcare, better health for the community, and better healthcare, lower healthcare costs. Next slide. And that is my presentation on mobile integrated healthcare versus community paramedicine. Again, community paramedics fall heavily into the mobile integrated healthcare, and a lot of times they are used interchangeably right now in the current part of the world that we're in, but you do see a difference as you start to expand these programs out in community paramedicine versus mobile integrated healthcare. Are there any questions?
Thank you very, very much. Councilwoman James?
Yes, so thank you so much for the presentation.
Yes, ma'am.
So I just want to try to get an understanding. Is this two different programs? Are they programs that will be housed inside the fire department, EMS department, or is this new staffing that we have to try to?
So we could use current staffing levels with paramedics. Once we get back up to staff on paramedics, we would be able to use them as community paramedicine. The program itself more than likely would have to add staff as well that would be specialized in this, depending on the hours of service that we wanted to offer.
So, and then, in that same question, is it 911 calls that you're getting, or is it just someone that wants someone to come to their house? Is this, I'm trying to understand how this program would act.
So ultimately, it would reduce 911 calls. So if somebody called 911 and said they'd been nauseous and vomiting for 2 days, you could send the mobile integrated healthcare unit out there and have them assessed by a mid-level provider or a specially trained paramedic with immediate access to a physician to see if they're needing to go to the hospital immediately via ambulance is required. So this program is designed to set people up that call 911 for non-emergent reasons with the proper care that they need at the time.
So one thing that I would say too is I know that there was a grant, I believe, I don't know if it's called a grant, but it's some millions of dollars that Clayton County Public School received to have healthcare available in their schools. So I know as a part of, and Councilman Gutierrez may know more about this than me, but as a part of the Forest Park Middle School that they're building, there is going to be a section that's for medical service, healthcare services, and they're trying to partner with people to come in to actually be doctors and nurses or whatever, and they can treat not only the kids that are there at the school, but even parents and extended family that may, may not have access to going way downtown to go to a doctor's appointment or what have you. So that may be something that could be partnered along with it.
Absolutely.
Just so you.
Absolutely.
Councilman Antoine?
Thank you so much. I heard about this program from other cities. Thank you. You got my support.
Thank you, sir.
Councilman Gutierrez?
Thank you, Mr. Jomini. We missed you. To
Missed
see
you
the
too.
mustache is still solid. So yeah, just to add the Kims, yeah, we did get 2 full grants where Huey Elementary and Forest Park Middle School will have these clinics. I think they're accepting bids for the provider. I think Morehouse, Emory, there's a few different ones that are bidding on them. But this is great that just our community will have access to something like this. Thank you for the presentation.
Councilwoman Wells?
Yes, thank you so much for everything, for all that you do. That was a great presentation and very informative for me,
Thank you, ma'am.
governing body and the residents, so thank you.
Thank you, ma'am.
Councilman Mears?
Yes, sir. Thank you for the presentation. I got one question. Do they still have, on-duty nurses at the schools?
I am not
I know in high school,
sure.
we had when I went back when Main Street was dirt, they had a registered nurse, had a clinic and all that kind of stuff. Maybe, do we still do that?
I do know that the schools do offer some nursing staff. As far as registered nurse, I'm not sure on that question.
Thank you.
All right, thank you. The question that I had was on the needs assessment.
Yes, ma'am.
Do you think it would be best to do a needs assessment based contacting, I guess, your office to get an idea of the calls that you receive, or doing an actual community outreach needs assessment?
Honestly, I think it would be best to do a mixture of the two. Not just to see the 911 calls that we're getting, but also see kind of what the community would like to see from it as well. Especially when it comes to what kind of health services are we missing in our community. I mean, we see doctor's offices up and down Forest Parkway, but do we have a cardiologist in the city? Do we have somebody who can specifically treat different conditions? And this would be a way for us to say, okay, well, we need a cardiologist. And then we partner with a cardiologist and we can provide those through telemedicine or through in-person appointments, and then can arrange for transport to those doctors instead of overloading a hospital with a patient that might not need to be there, and ultimately would expose that patient to hospital-borne illnesses that would keep them sick.
And you mentioned the additional staff, or if we were properly staffed, do you know about how many more souls we would need to be properly staffed for such a program?
I think we're down approximately 5 or 6 paramedics at this time.
And what about the vehicles? Would it be something we would could use our current ambulance for? Will we need something separate designated just for this, so that if it's in use and we get a call on this side, then it's not one or the other?
We have the vehicles available.
All right.
Mayor Butler, I do just as a follow-up. So I want to be, just so that we can have this as an actionable item. So it sounds like this is a program to alleviate the demand on 911 and the hospitals essentially. I want to say it was Chief Chris talked about a program through 911, but I don't remember what that was that the dispatchers were doing to help alleviate some of that. What was it called? I'm curious if we're talking about the same thing.
No, this, the item that I plan on bringing forth here soon will allow dispatchers to perform life-saving measures via telephone.
Okay. And then the second question, to Mayor Butler's question, if there are vehicles, if there's an issue with we know that one of our budgetary items is adding ambulances.
Correct.
Based upon the volume, what vehicles would you use?
So if this particular service, good evening, Mayor and Council. If this particular service would be implemented, we can use reserve vehicles, not our first line vehicles, because those are the ones that serve the communities in the event of a 911 call. Reserve vehicles may be used, but again, this is something that we can discuss as far as once we do our needs assessment. Again, we are short about 6 paramedics. So again, we need to do a needs assessment just externally, but also internally as far as staffing and things of that nature.
So do you think, given the age range of our residents, that a program like this, it may be best to start small and then build up to where maybe we just focus on our legacy residents or something of that sort.
Again, good question. Again, it's gonna be based on the needs of the community, like Jelmini said.
I think that's it.
Yes, ma'am.
Presentation.
Good presentation, though,
Thank you
Jelmini.
so much. Item 2, council presentation on the January fiscal year 23-24 financial report, background and history. The Forest Park Finance Department will present the monthly financial report for January for the fiscal year 23-24 budget. Good evening, sir.
Good evening, Mayor and Council. This is the January monthly financial report. From this point on, we'll be doing it monthly. Last time we did it was mid-year, so that's been covered 6 months. But we'll be going from month to month now. Next slide. This is just a little about the city of Forest Park. This will be in most of the my presentation when I present. Next slide. We have the pictures of the next slide. Picture of the city manager and the names of the directors. Starting off with the first slide here for the presentation is we got the general fund for January summary by category. This right here is shows you the revenue versus the expenses, and it gives you also a graph showing you the pictures of the revenue and where the expenses are. Right now for the month of January year to date, we're revenues are coming in at $26,012,217. Our expenses are coming in at $17,048,114. Last month we reported, which was mid-year, it came, the revenues came in about 23.3 million. So with that, looking at the revenue, what we have now is we increased it about 2.7. Last year we had, last time we presented, the expenses came in at about 15.8. This time we're reporting the 17.0. This is a 1.2 increase for expenses. Next slide. This shows the general fund summary by department. This shows the expense budget to actual, of course, the balance, and also shows the percentage of the budget that was used. Right now, we're trending pretty much in line with how the budget should be going each month. Pretty much everything, all the departments are right at that 50% mark. The pie graph next to it shows the percentage of the budget that was used. This just give you a better visual view instead of looking at the numbers like that. Next slide. This slide right here shows, like last time, all the other funds that we have in the city. We're still in the midst of going through and trying to clean up. I think next month, in March, we'll be trying to bring some amendments to you so we can try to clean up some of these budgets to make sure that we have a revenue budget that equals to our expense budget. Next slide. Next slide. That's pretty much it. Any questions?
Thank you very much, sir. Councilwoman James.
No questions, thank you.
Councilman Antoine.
Man,
Councilman Gutierrez.
thank you, sir.
Councilwoman Wells. Thank you. And Councilman Mears.
All right, thank you.
Item 3, council presentation on development impact fees, background and history. Development impact fees are governed one-time fees charged to land developers that assist local governments in defraying costs due to expanding services and public facilities. Such fees are governed by the requirements set forth by the Georgia Development Impact Fee Act, OCGA 36-71, enacted into law in 1990. Good evening, ma'am.
Good evening, Mayor and Council.
Good evening.
So development impact fees, as you stated, they are governed by the requirements of the Georgia Development Impact Fee Act, which was enacted into law in 1990. Development impact fees may only be imposed by ordinance passed by your local government. Impact fees are one-time fees that are charged to land developers that help defray the cost of expanding public facilities and services that otherwise would be passed on to your local taxpayers. Impact fees may not be used to defray regular maintenance and operations expenses for any public facility. However, 3% of all fees collected can be used to cover administration costs associated with the local impact fee ordinance. Basic requirements a local government must meet to pass an ordinance imposing impact fees. Number one is to adopt a comprehensive plan with the capital improvement element approved by the Department of Community Affairs. If a community has an existing adopted comprehensive plan, the comprehensive plan must be amended to include that capital improvement element. Basic requirements a local government must meet to pass an ordinance imposing such a fee, including the following items developed individually for each category to be financed with impact fees. A, inventory and map existing levels of service, establish service areas, project future levels of service, project facility needs based on levels of service and growth projections in the comprehensive plan, create a schedule of improvements for the first 5 years after the capital improvement element is adopted for needed facility improvements with projected funding sources. Number one, list project by service area, identify start and completion dates for each project, estimate total project cost, identify funding sources for each project, including the percentage of project costs to be paid from impact fees. F, develop policy statements regarding any proposed exemptions from impact fees. Basic requirements a local government must meet to pass an ordinance imposing impact fees. Establish a development impact fee advisory committee composed of at least 50% of the development, building, or real estate community. The committee shall be composed of not less than 5 nor more than 10 members. Any agencies, authorities that provide critical public facilities and services to the jurisdiction should participate to provide information of any proposed development of public facilities in the community, i.e. your school boards, development authorities, water sewer authorities. Local governments must hold 2 public hearings prior to the adoption of the impact fee ordinance. The second hearing shall be held at least 2 weeks after the first hearing. It is important for the CIE to be consistent with other planning documents such as park master plans, transportation improvement plan programs, and any other adopted studies. These documents should be used in preparing the CIE and updated to reflect the capital improvements if necessary. Uses for impact fees. Number one, libraries, recreation parks, open space and related facilities, water supply production, treatment, and distribution facilities, roads, bridges, including right-of-ways, traffic signals, landscaping, and any components of state, federal highways, public safety, such as police, jails, fire, and EMS facilities, wastewater treatment, wastewater collection and disposal facilities, stormwater management, such as collection, retention, detention, treatment, and disposal facilities, flood control facilities, and bank and shore protection and enhancement improvements. Other provisions of the act include impact fees must be expended in the same service areas where they are collected. Developers must be given impact fee credits for any system improvements they construct. Communities charging impact fees must demonstrate a direct benefit returning to the developer that is proportionate to the fee he pays. Developers are entitled to appeal impact fees they consider disproportionate or unfair. All development impact fee funds shall be maintained in one or more interest-bearing accounts. Municipalities, counties jointly affected by development are authorized to enter into intergovernmental agreements with each other, with authorities or with the state for purposes of developing joint plans for capital improvements or for the purpose of agreeing to collect, expend development impact fees for system improvements. And that concludes my presentation.
Mayor Butler.
Yes, sir.
So I want to be very clear, council members. I know you were inundated with a lot of information, but the reason why we wanted to bring this before you tonight is because with all of the development that we've had in the city of Forest Park, along with all of the development that we know is coming up, we wanted to be ever so intentional. When I asked for this presentation, wanted to be ever so intentional about ensuring that everything we are able to collect on behalf of our city, for those things that are coming in, the impact that it has on police, the impact that it has on fire, as well as some of our various departments, that there is a fund created, which is mandatory in order for us to do this. So tonight, we're just seeking your approval to move forward in the process. There's a methodology that comes behind us doing this study. So the URA is the only entity that has ever charged something similar to an impact fee. They actually charge an infrastructure fee, so that if new development is coming in, they paid into a pot of money to replace some of the water authority infrastructure that was there. So we just wanted to get some of your thought processes. I know a lot of what you heard is a lot of the legal side of it, but I wanted to break it down so that you could have an understanding of what we're actually trying to do.
Thank you. Councilwoman James?
Yeah, so a couple questions I have. I saw that as a part of the presentation that the fee can only be used in the area, expended in the area in which the development is done. I think that's what I understand, right? So like if there's a development done on, Main Street, then whatever the fee is collected, it will be for services rendered on Main Street. Is that true? Because I also saw on here where it says, some of the impact fees could pay for libraries, recreation parks, open space, water supply, et cetera. So I just wanted to kind of get an understanding of, if we have a fund or some sort where developers are paying into this fee, is it confined to a certain area that can be developed, or is it citywide that we could use the funds for?
So similar to how, I guess the easiest way, with the Downtown Development Authority of the URA, they have their own territory. So we would essentially establish a boundary in which we could expend these funds. It would be our service target area. And through this committee that would be established, we would come up with what those said plans are. So I don't know that there's a restriction to a specific property, as much as it is us just defining what that area will be that we will use the funds. And I would probably delineate the majority of the city of Forest Park, if legally we are allowed to do it.
So, it shouldn't be just citywide. There does have to be specific service areas. And so with the impact fee, it is related to the development that's coming, and directly around the delineated area. So let's say a developer comes in and builds 100 homes and you don't have a library in that area to support it, or there's not enough city personnel to ambulances. You could use the impact fees for that purpose to expand city services in that area.
Absolutely. Understanding that with the purchase of the ambulance, that ambulance wouldn't just be restricted to that area.
Right.
It would still circulate.
But it's directly as a result of that.
So
Perfect segue.
So additionally, do you see, well, I know we haven't gotten into the nuts and bolts of what it's gonna be and how much it's gonna be or whatever, but do you see a downside to developers not agreeing or not wanting to do development because of the fee?
I think if I could answer it professionally, I would say that the only downside is that the developers, it costs them more money.
Mhm.
The personal side would be when they go to these areas, Atlanta and North, they're paying the impact fees anyway. But when they come to the Southern Crescent area, because there are not, I don't know of any in Clayton, any of the municipalities that impose an impact fee, they're not paying it. But if they were going on the north side to do that development, they pay it anyway. And a lot of cities around the state are starting to really look in and hone in on setting up and creating these impact or this impact fee structure, because you are right. If we use the analogy with the additional 100 homes, well, we still have to service those additional 100 individuals that live there.
Are you finished?
Yeah.
Councilman Antoine? Councilman Gutierrez?
Yeah, thank you, Miss. I guess similar to Kim, I guess I just wanted to make sure that it was something that we can expand and not limit it to a certain area. I've heard of not impact fees. That's not the term I heard. They were called more like I guess like a community charge or something else. I heard it recently. Me and Miss White heard it at the DEI class when they were talking about economic development through that DEI lens, and making sure that there was equity across the board for the community when big companies or corporations or any type of builder comes to a community. And some of the examples they gave were like, similar to these. I think they added tree fund or incubator funds. But I don't know if it was like specifically this, like impact fees. It seems like a similar term. And I had talked to Mr. Clark, and crazy enough, it was already on the agenda as development impact fee. So I just want to make sure that it's not, I don't know if it's even possible or legal, that it's not just stuck to one area. But if it's a service for everybody, then that makes sense.
Councilwoman Wells?
No, thank you.
Councilman Mears?
Thank you for the presentation.
So I understand that this cannot be retroactively applied. And so this would have to be something that's embedded into the contracts that we would initiate moving forward, correct?
So it would be an ordinance, and then it would apply to any new development coming in. So it would essentially be as a part of the permitting process, there would be a development impact fee, a part of that attached to it.
Okay. All right, thank you. This is just on for discussion.
Yes,
I'm gonna
ma'am.
put this on
It
the
is.
regular session. Item 4, council discussion and approval of the One Light Initiative. LED streetlights, upgrades, and additions. Background and history. The One Light Initiative is a collaborative effort between the City of Forest Park and Georgia Power aimed at enhancing the city's lighting infrastructure through the replacement of high-intensity discharge fixtures with more efficient light-emitting lights. These enhancements are not only focused on safety, but also contribute to the city's sustainability goals by reducing the frequency of replacements and overall maintenance costs. As part of this initiative, Georgia Power has identified specific areas around city buildings that require upgrades to address safety concerns and reduce outages. Below is a summary of the proposed upgrades, additional fixtures for each location, and its financial impact. Fire Station 1 fixture upgrade, no price charge. Fire Station 2, 3 fixtures upgrade, no charge. Community Center, 3 fixture upgrades at no charge. The Recreation Building, 8 fixtures at no charge. Public Works, 16 fixtures, no charge. Main Street Park, 8 fixtures, no charge. Police Department, 10 fixtures, no charge. Museum, 1 additional light fixture with an increase of $660 per year. City Hall, 2 additional light fixtures at a rate of an increase of $648 per year. Alder Park, 1 additional light fixture with a price increase of $660 per year. Theater Park, 1 additional light fixture, price increase of $463.56 per year. Perkins Park, 1 additional light fixture and 1 fixture upgrade, price increase $672 per year. And Second Street Park, 1 additional light fixture with a price increase of $312 per year. So good evening, sir.
Good evening, Mayor and Council. As y'all very well know, several months ago, we went out for a night ride with Georgia Power, and we just checked a lot of areas, and we checked the side parks and a lot of the city buildings. And this was just a small portion of what we seen that needed to be addressed. And basically you got 49 fixtures that they're upgrading to LED at no charge. And we're adding 8 fixtures, most of them at the side parks that has one or no lights at all. That was very unsafe. And we went through there, and this is just phase 1 of the lighting next to that the city manager, Ricky Clark, has put in place. And we'll be coming up with some more down the road to make Forest Park brighter.
Thank you so much, Councilwoman James.
One light, Forest Park. No, I just have one question. I was trying to find in the documentation, museum, where is that? Where is?
That would be the Girl Scout hut or over there where the soccer field is. At the corner of George Avenue and Ash Street.
The building that sits by itself?
It's like a house.
Yes.
Oh, okay. Behind the. Okay,
Yes.
okay. That's all I have. Thank you.
No
Councilman
problem.
Antoine,
No question.
Councilman Gutierrez,
No, thank you, buddy.
Councilwoman Wells.
Yeah, well, my only question was the different fee. Why is it no charge for some and charges for the others?
I think that is a great question. So as you know, my commitment was to repair, I believe Mr. Jinks said it was 1,900 lights around this city. For some of them, the utilities are so old that they have to replace the entire pole. And for some of them, it doesn't require that. You know, through this partnership with Georgia Power, ordinarily, you would have to pay for each of these. But through this partnership, because we're replacing so many, some of them they're giving to us pro bono. Now, some of these with the parks, the reason why we put this on the agenda tonight, the main reason so that the council members can see, but these are new light fixtures just to ensure that all of your park facilities have additional lighting in them. And I think we hit every park with this. And then Ms. Wells, you'll be happy to know because I know you requested this. We're also going down Old Dixie as well as Jonesboro Road, but those were just larger contracts we have to budget for. But now, matter of fact, we're adding Forest Parkway in as well. The lighting infrastructure dates back to the 70s. And what happened was the city decided that they were going to purchase the light and maintain the light. Well, in some of the areas we are on, because we're on fixed billing, the lights haven't worked for over a decade, but you're on fixed billing, so you're still getting paid. You're paying the same cost as if it was working. So, you know, I think that's a great point about the no prices, but that's why.
And to answer your question, like on Second Street, Park, them were just Home Depot lights that Public Works installed. And they're actually taking them down and installing the LED Georgia Power light. So they'll be a lot brighter and a lot nicer.
When you say the Home Depot lights, like,
Like what you would buy and mount in your, on your yard.
oh,
Councilman Mears.
Yes, sir. I'm for this, because, one of the locations is in my ward and it is dark as a tomb in my park. So I'm sure my constituents in that area will love it. Thank you.
And don't hold me to it, but the Georgia Power rep said that if all this went through, that it could be all up and operational in 8 to 10 weeks.
And we plan on, again, we are still waiting to finalize some things, but we also plan on fixing these parks in that same time frame.
Excellent. All right, thank you very much, sir.
Thank you.
And so we do have executive session item and Attorney Matricardi, you think we have enough time? Okay, is there a motion to recess and enter into executive session for personnel? Okay, thank you. That was Councilman Councilman Mears, is there a second?
second.
That's Councilwoman Wells. All in favor?
Aye.
All right, thank you. Is there a motion to adjourn the executive session and reconvene into our work session?
So move.
That was Councilwoman James. Is there a second?
Second.
That was Councilman Mears. All in favor?
Aye.
Opposed? All right, thank you. Now is there a motion to adjourn the work session?
So move.
Councilwoman James, is there a second?
Second.
That was Councilman Mears. All in favor?
Aye.
All right, thank you. So it is 7:02. And the regular session for mayor and council for February 19th is called to order. I'm going to ask everyone who's able to do so to stand for the invocation and remain standing for the Pledge of Allegiance. And tonight's invocation is done by Elder Cook of Rock Church.
Amen. Let us pray. Heavenly Father, we just come to you tonight, first just saying thank you for another day of life and strength, Father God. We're glad that we're able to gather together as a city to discuss the business and the needs and the things, God, that's going on in the city of Forest Park. God, we thank you for every council member and even the mayor, God, who you set in place for this time and season of life. Father, I pray you impart to them your wisdom, Father God, and your understanding, Father God. Continue to impart unity to them, Father God, that they may be a commanded blessing upon our city. God, I thank you, Lord, even for the residents, Father God, represented here tonight. I pray that you continue to bless them with strength and with peace. God, may everything their hands touch prosper. God, we just want to come in agreement with your will for this city. We want you to be glorified. So God, help us to make decisions and choices that'll lead us to the blessing. Forgive us for things that we may have done, God, that may have brought shame or things that may have not put us in a place to be blessed. Father, we just commit every act to you now. We welcome your presence, and it's in Jesus' name we pray. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
For liberty and justice for all.
Okay. Ms. Rainey, roll call, please.
Yes, good evening, Honorable Mayor, council members, and City Manager, Mr. Clark. This is the roll call for February 19th regular session. Mayor Butler,
Present.
Councilmember James,
Present.
Councilmember Anton,
Good evening, everybody.
Councilmember Gutierrez, Councilmember Akins Wells,
Here.
Councilmember Mears.
here.
Mayor Butler, you have a quorum.
Thank you. Is there a motion to adopt tonight's agenda?
So move.
That was Councilwoman James. Is there a second?
Second.
That was Councilman Mears. Is there any discussion? All in favor?
Aye.
All right, thank you. Approval of the minutes. Have everyone had the opportunity to review the work and regular meeting minutes from February 5th? And if so, are there any changes to be recommended? All right, not hearing any. Is there a motion to group said minutes together and approve as is?
So move.
That's Councilwoman Wells. Is there a second? That was Councilman Gutierrez. Is there any discussion? Ms. Rainey?
Councilmember James,
Yes.
Councilmember Anton,
Yes.
Councilmember Gutierrez, Councilmember Akins Wells,
Yes.
Councilmember Mears.
Here.
Thank you. Our public comment period, Ms.
Here.
Oh. That's a yes.
Yeah.
Let's see, public comment period. Ms. Rainey, can you please read our disclaimers?
Yes. Section 2-1-7 Rules of Procedure and Decorum. A, comments will be limited to a total of 3 minutes per speaker. 21 minutes are allotted in total. B, members of the public are not allowed to participate in any debate or discussion conducted by the governing body members. C, all public comments must be limited to matters on the agenda or over which the governing body has jurisdiction. D, each speaker must maintain a decorous demeanor and refrain from personal attacks upon members of the governing body or employees, shouting and using obscene language. E, all questions and comments shall be directed to the presiding officer. F, members of the governing body may respond to the comments during their closing comments if they desire.
Thank you very much. Tonight, we have 3 that have signed up, and we will begin with Ms. Franklin.
Good afternoon, good evening, Mayor and City Council. My comment tonight is about the model meeting that we had on the 8th of this month. I was a little disappointed that none of my representatives were there. There were only 12 people there, period. 3 of us there were
from 3 different wards. And I think you all know that I'm gonna be at every meeting to support my county, because if I agree with what's going on, I'm gonna be there to support you all. And one thing that I really was concerned about, number one, I don't have to ride the bus, thank God. Can't say that I won't have to one day before I leave this world, but right now I'm fortunate enough to not have to ride the bus. But they announced 5 different routes that was gonna be canceled on the route of 195. I can't tell you where it was because number one, like I said, I don't ride the bus. And I didn't find out about the meeting until the morning of the meeting. I didn't get a notice from anybody that we were gonna have it. So I can imagine if I didn't get a notice, the people that really rode the bus or what have you, could have possibly been there, didn't get one either. And as I said again, I was just disappointed that none of my representatives were there. So you could have gone back and maybe notified the people in your ward that the routes were gonna be canceled, and especially on 195. Because on the other route, which is in the Fort Gillum, they were adding to it and taking away from 195. So I just wanted to let you all know that I was really, really disappointed that I didn't see any of you all there. I really was. Okay, all right.
Thank you. Mr. Parker.
Howdy.
Hello.
I submitted a code enforcement ticket a few years ago due to water or sewage from the house next to mine seeping onto my front lawn. The issue was never addressed and the ticket was closed later with no comment. The code enforcement officer could never explain to me a valid reason for closing the ticket, and he would not come back for a visit and look out. I called City Hall and asked the city manager to look into this. I alone cannot say names here. I didn't receive a call back, so I called yet again, got a long speech by the city manager that did not address the ticket. I attempted to speak to her over the phone several times after with no success. One Thursday, I called to speak with her and was told she was not there. I asked if there were any meetings that night and told there was a council-appointed board meeting. On this board happened to be the then property manager of the home next to mine, as well as the city manager. My intent was to attend to this meeting to get FaceTime with the city manager, ask her in person for clarity. Due to the odd interactions I had with the various city employees and officials regarding this particular issue, I chose to record this event. I arrived early and was the only citizen in attendance. As I waited outside the glass doors behind us, the members of the board came up to them, including the property manager of the home beside me. They attempted to open the doors, but they were locked. The group complained that this was out of order, never happened, this wasn't normal. Continued to wait. The group left towards the parking lot. A few minutes later, the city manager walked up with a Forest Park police officer and the group. The city manager then unlocked the doors. I was immediately required to go through the security checkpoint by the officer. Now, I had been to a few of these smaller meetings before, and I swear to you now, police officers were never assigned and present at those smaller meetings, and the security checkpoint was never used, period. May have been after I sent an email, but not before. Proof of this fact is heard on the video when 2 different members of the board were very concerned and confused about the security checkpoint. Did I mention I was the only citizen there? Did I mention the security checkpoint had never been used at this meeting before? This was the first of many times a Forest Park police officer was used in a retaliatory manner by a city official for me simply asking questions and holding them accountable. This has happened more than a dozen times since the first time. I have come before this body for many years saying these same exact things, that Forest Park city officials and police officers routinely retaliate against me for speaking out against them and holding them accountable. They always deny this. Well, a few months ago, everyone that was in attendance at this meeting saw you, Mayor, retaliate against me for speaking out against the Forest Park Police Department. You didn't like what was coming out of my mouth, so you retaliated against me with police officers and violated my First Amendment right to speech. It's a pattern. It's happened several times. That was the first, and there's been many. I'm going to keep coming back to talk about these. This is what y'all have purview over, so I will continue to come back. I will see you at the next meeting with another issue of refusal of service from code enforcement about the same house, and also more talk about your personal stormtroopers, Mayor. Thank you for listening.
Ms. Wright.
Good evening, Mayor, Council, and CM. How y'all doing this evening? I'm coming on behalf of many members in my community, on behalf of the recycle. Now, 4 hours up there couldn't have been costing the city that much money. Y'all closed that recycle center down. We don't have anywhere to take our tires. I had a door change. What do we take? We got to go way to Lovejoy to dump it. Can y'all please reconsider in bringing that recycle center back? Because I was ready to, bring a little petition, because I know at least 100 people in my community that needs that recycle center back. We really need it back. So please reconsider hiring somebody to come back and open that recycle center, because we don't have anywhere to take our stuff now. You got to pay for it. I guess if you take it to the landfill, I don't even know where to take it. But please reconsider opening our recycle center. Or do I need to bring back a petition on all of Forest Park? And I will if we need to, but just reconsider that, please. Thank you.
Yeah. Mr. Clark, you have the floor, sir.
Thank you, members of the governing body. First, this report is for January. Next month, I'll be presenting to you 2 reports, one for the month of February, as well as our annual report. As we look back at yet another successful year, I'm simply excited about all of these significant accomplishments and milestones that we've achieved together as one community. Since becoming your city manager, I've made it my priority to reinforce the notion that serving our constituents is all about trust. That's why I'm happy to report that the city of Forest Park was recently awarded qualified local governmental status by the Georgia Department of Community Affairs. As part of this distinguished status, the city will be able to continue assessing special funding to assist with long-term community planning initiatives, infrastructure needs, and economic development projects. By collaborating with our governing body and key stakeholders, we will remain steadfast in our pursuit of providing the highest level of customer service while also managing resources with the utmost care. None of it would be possible without our amazing team, of which I would like to introduce one of our newest members of the team. One of our newest members of the team, Ms. Bridget Jackson Burney, as our new permit tech in the Planning and Community Development Department. Ms. Jackson Burney comes to us with many years of service in local government work, and we're excited about how she will assist us in developing the concierge model of service that we look to deploy within our Planning and Community Development Department. The other thing, thank you, Ms. The other thing that we are most proud of is that we have employees that are continuing to better themselves, hence leaning them to be better for the organization. We're also super excited to celebrate the accomplishments of our clerk, Ms. Randy Rainey, as she recently completed her master's certification from the University of Georgia Carl Vinson Institute of Government. It's through the efforts of employees like Ms. Rainey, new employees, like we have in various departments, that we continue to be able to push forward our initiative of One Forest Park. I'd like to thank our governing body and most importantly, the great residents of the city for entrusting in me the arduous task of being your city manager. Next slide, please. As you can see, we continue month by month to celebrate all of the many years of service that our employees continue to exemplify. For this month, we have Troy Sanders celebrating 31 years and Ms. Lisa Waller celebrating 23 years. They were not able to be with us here on tonight, but we're just super excited that we have an amazing workforce. We'd be remiss if we did not also celebrate, some of the anniversaries of our council members. So Councilmember Anton Dabuz Anton, celebrating 10 years. Our longest serving Councilwoman Latricia Shante Wells Aiken, celebrating 12 years. Councilman Mears celebrating 8 years. Councilwoman Kimberly James celebrating 6 years. Our mayor is celebrating 6 years, as well as Councilman Gutierrez is celebrating 4 years. So we'd like to recognize our council members as you too are part of our employee anniversary history. As we talk about the accolades of our employees and how they continue to invest in themselves by going to all of these training opportunities, we'd also like to shout out Councilman Hector Gutierrez, as he was recently recognized as one of the 40 under 40 for the state of Georgia. All right, next slide, please. This is just a cap shot of some of our events throughout the course of the month. There on the top, you can see Councilwoman Akins Wells and Councilman Gutierrez as they are being sworn in. And then now down at the bottom, you'll see both the chief and myself as we recognize Officer Cash, who died in the line of duty. And again, just various pictures across the organization. I see Mayor Butler to the side with a plate, but I'm not sure what she's celebrating. Next slide, please. So just for the legislative corner, council members, again, this is a report and a snapshot of the work of our council aides for the month of January. They fielded approximately 36 calls from constituents, processed 154 home applications, as well as 55 new one-click subscribers were communicated with. For Mayor Butler, the Reading Club in Fountain Elementary, as well as Cooking with Fire for Ward 1, Councilwoman Kimberly James, her ward meetings at 696 Main Street. Councilmember Anton celebrated a Haiti Summit up in DC. Councilman Hector Gutierrez, Cities United, as well as his swearing in. Councilwoman Wells, we continued with the Wellness with Wells and Councilmember and the very large job fair that was held, and Councilman Mears, the job fair. I'd like to take a quick pause right there and provide a snapshot of our home program. As of February 9th, 2024, we had a total of 276 applicants. Of course, the application program is now closed. Of the 276, we had 104 that were incomplete, 23 that were disqualified due to residency outside of the city limits. Council members, for your respective wards, I offer you the following numbers. For Ward 1, we had 27 individuals that were verified. For Ward 2, we had 33 constituents that were verified. For Ward 3, let me repeat. Ward 1, 27, Ward 2, 33, Ward 3, 27, Ward 4, 35 were verified, and Ward 5, 20 were verified. Again, I'd like to shout out Ms. Pauline for all of her efforts in standing up this program, hence saving the city $30,000 or more. All right, moving on. Again, the next picture that you'll see in this report is just the R.L. Cash Memorial that the police department initiated. All right, moving on, we're going to go on to capital projects. So for our first capital projects, just with the city center, next slide, please, Mr. Next slide, please. Next slide, please. Next slide, please. Next slide, please. For the city center, again, we're continuing to work on the new city center. All of the space needs analyses have been completed. The task order has been executed, and we are expecting a 3D model of the plan before July of this year for us to present to the governing body. Next slide, please. All of the welcome signs have been installed now. The total cost of the project was $296,000. Construction cost was $218,000 for a final construction cost $213,000. As you know, the governing body approved the Georgia Power proposal to begin installation of the lighting around all of those various signs. Next slide, please. The only thing I'd like to note for the public safety building at Fort Gillum is that we were able to come in under budget, with the final construction cost being plus or minus $7.8 million. For the Main Street Streetscape project, with a construction cost of $3.7 million, we are finally complete with that project, and we're looking forward to scheduling a date when there are sunnier skies for this governing body to enjoy a ribbon cutting ceremony with the community. Next slide, please. The incubator space is still underway with a total estimated cost of $4.4 million. Since we did the initial presentation in both the city council meeting as well as the Board of Commissioners meeting, we have seen an increase in our press regarding this effort. So we're excited about what the future holds with this project as we wait to see how much funding we're going to get from some of our local partners. Next slide, please. Again, we're working through the plan documents for the Star Park renovation, as well as we're working with our partners at the school district just to figure out some programming for one of the existing stadiums out there at the park. Next slide, please. On today, myself, Chief Chris, and Chief Clemens met to discuss the public joint training facility, and we believe we have some amazing plans that will come out of that. All right, next slide, please. Next slide. For our city clerk's office, just a quick update. For the month of January, we fielded 169 open records requests. Next slide, please. For our code enforcement department, they continue to ensure that all of the employees within this department are properly trained. And now the trainer is training the employees. So each of the code enforcement officers have the ability to teach a different course every month within the Office of Code Enforcement. I would like to pause and recognize and acknowledge Miss Monica Miller here from our Miss
It's missing everybody's name, but.
from our code enforcement department. I'm sorry, Miss Monica. It's been a day of messing up everybody's name today. For the month of January, our code enforcement department heard a total of 611 cases. Our economic development department continues to work through all of the various projects from Main Street to Fort Gillum to other areas, and we're excited. I know there was a lot of questions about Class 6 Boutique, but the Architectural Design Review Board heard this matter last Friday, and it was approved as one of the new facelifts for Main Street. So that is simply exciting. For our Office of Finance, we collected $361,000 for business licenses with an overall revenue of $1.0 million for the month of January. All right, pictured on the next slide is just a snapshot of our police department on some of the new electrical bikes. This was the countywide Martin Luther King ceremony held there in the city of Jonesboro, where all of the local municipalities participated in tandem with our Clayton County Board of Commissioners. Next, for our fire department, again, just several calls for the month of January. They fielded 338 EMS calls, of which 175 of them was patients treated. And one of the other things I want to note is the patient refusal numbers at 110. In addition, they were able to deliver laptop computers to students at Forest Park High School and Ash Street, as well as Chief Clemens held a cooking with the fire experience and also provided fire extinguisher training there at the Cortex at Fort Gillum. All right, next slide, please. Next slide, please. For our Human Resources Department, we continue to be aggressive in trying to ensure that we backfill all of our vacant positions. This slide shows all of the vacant positions across the organization. I know there have been some positions on here, i.e. foremen and other positions that we want these to come off of this list so that they're not there every month. So we want to actively seek to get all of these positions filled by the time we start our budget process, or we're going to see where we can have the reductions. All right, next slide, please. Next slide. Again, just the mighty men and women in the Forest Park Police Department. I guess we like the picture so much we used it twice. We continue to be extremely proud for our IT department. For the month of January, there was a total of 259 tickets open with an average closure rate of 7.2 days. Again, we're still working to get that closure rate down. But if you'll remember, Council, we approved a contract about 4 months ago by in which we saved approximately $92,000 from doing the majority of the work that they outsourced in-house. And to date, it's been going amazingly well. All right, next slide, please. We'll back up one, Mr. Virgil. One of the things I really want to call your attention to as we listen to the news and we hear all of the opportunities and communities that have been affected with cyber attacks, I want to show you this slide. It shows that there were 13.9 events analyzed within our local municipality for the month of January for cyber attack opportunities, of which there were 16 different signals that were alerted. And what that means is the Barracuda, I know that Councilman Gutierrez just today was talking about Barracuda. The Barracuda and our firewalls are really helping us to prevent any cyber attacks as we work with our IT professionals to ensure that all of our infrastructure is as strong as it can be. I really want to highlight that for you. Next slide. Our municipal courts under the administration of Dr. Dorothy Roper Jackson for the month of January. Ms. Jackson has done an amazing job of really figuring out how to ensure that those court operations are ran seamlessly, as well as running one of our amnesty programs for that month. And that amnesty program will continue throughout the next 2 months, I believe, Ms. Roper Jackson. All right, next slide, please. For our planning and community development department, for our residential permits for January, there were 6 residential permits issued and 2 commercial permits issued. Next slide, please. For our police department, our police chief held several events, reading with the chief at Huey Elementary and Fountain Elementary, as well as a coffee with the chief and a chat and chew event at Big Days Cheesesteak. We're going to ensure that as we continue these community policing efforts within our police department, that we also add some healthier options for the chat and chew events. For the month of December, the traffic stops were a total of 1,934 active traffic stops. New hires for the month of January include Mr. Reginald Caldwell and Ms. Sharice James, who is here with us tonight. Ms. James, would you please stand? All right, for the month of January, if you look at that percentage change, for the month of January, we had 2 homicides. However, in January, there were 0 homicide. What we're seeing is a lot of this crime is transient crime, and we're still working to ensure that they have the best technology to try to prevent and mitigate some of these efforts. For the Office of Public Works, next slide, please. For the month of January, there were a total of 12 days where they used a street sweeper, cleaning about 73.11 square miles. Also, there were 38 work orders to replace just various street signs and 3 work orders to clean the street sign. Council members will be reaching out to you as we finalize ordering of all of this playground equipment, because we are really seeking to get these parks done before the next budget cycle. It's an aggressive approach, but I think with the efforts of our Deputy Public Works Director, Mr. Nigel Watley, who has been working tirelessly through all of this, and Mr. Jenks, I feel confident that we can accomplish the intent of those funds that were appropriated several months ago. All right, next slide, please. For our Recreation and Leisure Department, for the month of January, we collected a total of $577 in our daily pass. And this was also the first year of our cheer competition squad, and the Forest Park girls placed second in their very first competition. So we're excited about that effort. If you have not had the opportunity to check out those Little League games at the gymnasium on Saturday, it is jam-packed and it is a lot of fun to watch those individuals run up and down the court. And my challenge is for a game with our governing body members that with the Little League, so that we can continue to build the momentum as we try to ensure that our kids are matriculating through our recreation program as a direct pipeline to our middle and high school. Members of this governing body, it has been my honor to present to you yet another city manager's report. I'm free to answer any questions that you may have.
Thank you very much. Councilwoman James, any questions or comments?
No questions, thank
Councilman
you.
Antoine? Councilman Gutierrez?
No, thank you.
Councilwoman Wells?
Yes. No questions, but just want to say thank you. This is good stuff. I'm always talking about them, can you make this shorter?
You did.
But the information is really good and we need it. Like, we've never had these type of city managers reports. So I just appreciate you so much.
Thank you.
Councilman Mears?
No, ma'am, no question, but a good report, sir.
All right, and I echo that. New business, council approval of the One Light Initiative. Is there a motion to approve this item?
So moved.
That's Councilwoman Wells. Is there a second?
I'll second.
That's Councilwoman James. Any discussion? All right, Ms. Rainey?
Councilmember James,
Yes.
Councilmember Anton.
Yes.
Councilmember Gutierrez, Councilmember Akins Wells,
Yes.
Councilmember Mears.
Thank you. All right, that is it. Closing comments by the governing body. Councilwoman James?
I knew she was gonna start with me. First of all, let me apologize to first of all, thank you all for coming out. We appreciate you. Ms. Franklin, I'm sorry I missed the meeting. We did have a URA meeting that night and we was honoring Mr. Abraham, who's gonna be leaving us. So we celebrated him on that evening, and we did have triple duty. I think Mr. Clark had to go to another meeting as well, but I hear you. And I know how important it is to get the information out about MARTA. Also, I want you all to remember to mark your calendar. It is Black History Month, and that is Sunday, February 25th. We'll be at Paradise Cultural Center for the Black History stage production. I went to the rehearsal on Saturday. It is going to be amazing. First class. So you all make sure you come. Doors open at 5:15. The show will start at 6 o'clock. It is absolutely free, free 99. For Forest Park residents, of course, we're not gonna be checking IDs, so just come get there early. And please let me know if you need a VIP person. I know our council members, I hope, will be there with their families. But come out for that. The ward meeting will be posted hopefully this week. I have to get the information to our council aides to upload it, but there's some wonderful information that's shared by all of our subject matter experts is what I call our directors and leaders of the city that gives information about what's happening in our city. And then, and there was one thing that I did not get an opportunity to put on the agenda, but I will have it for next week. Council members, I want you all to consider, we have to replace a board member. You are a board member who has resigned for personal reasons. And so I'm hoping to get a diverse member, either by Hispanic or Asian American on the board. But again, that's going to be up to you all. But as far as the URA board, they have to be a resident in the city of Forest Park to serve on that board. So we are looking to replace that person on the board. And with that said, I believe that's all. You all have a great evening.
Councilman Antoine,
Thank you, God. God bless.
Councilman Gutierrez.
Oh, thank you, everybody, for showing up. Thank you for the public comments. This is Franklin. I'm sorry, I didn't make it to that. I did look over the routes that were changed. Ms. Gardner forwarded to us the information. I see your concern with that. I'm gonna see, I guess, reach out to Marta and just see maybe what those numbers are and what that looks like, what type of impact that's gonna have on our community. I did see kind of some alternatives where it is, going around. But nonetheless, that those are routes lost. Mr. Parker, thank you for coming out again and letting us know how you feel. We'll follow up on that. Ms. Lois, I agree with you. We're gonna talk about that because you shouldn't go to Lovejoy if we have something like that here, even if it's for a few hours or a few times a week. Thank you for bringing that up because that's always started to need. So, Elder, thank you for slam dunking that prayer. We appreciate you. Real quick, I will be in attendance. Councilwoman James, excited about that show that they're going to be putting down here. But we also have Black History exhibit this Friday at the rec center. Some of our schools are going to be showing. I don't know if y'all ever seen in schools, they have those wax museums when you go and they represent a historical figure. So we'll have some performances. We're teaming up with our school district and with Victoria Williams, one of the reps for our area, to show exhibit our children and everything they're doing. If anybody would want to come out and perform, also we're open to that. We definitely want to make it a community event. Mr. Clark, thank you for that report, very thorough, and I always appreciate how you highlight our employees and their hard work. Our city is not it wouldn't be what it is without y'all's dedication every day. So shout out to Bruce again. I feel like I've given you like 3 goodbyes, Bruce, but we're gonna miss you, bud. But I'm happy that you're moving on to greater things and hopefully some rest, my friend. You worked a long life. Not calling you old. But yeah, so that's that. We're gonna be coming back with the food trucks next month. So I'm excited about that because I get to see all the community out there and my cleanups now that it's a little bit warmer. So Food Truck Friday, the first weekend of March, and then the cleanup right after on that Saturday. And we're also going to be having in April Selena Day. Looking for sponsors for that since it's not a budget event. Would love to dig into some pockets so they can help us with this. But thank you again. We had a meeting today that the mayor and Mr. Clark were at with the people of United Way, who have shown interest in investing in our community on different projects. So we're always looking on Inside. I can give more information if anybody would like to attend these meetings. They're open to the public, but they're to build community and just listen to the community and see what we can do better. And we can't improve unless we're all invested in this together. So thank you all for that. And sorry, I'm a little cranky today. I got a tooth removed. So I took a few medicines and I'm just tired.
Councilwoman Wells.
Thank you. Just like to say thank you to everyone for coming out, and Ms. Wright. I don't know why the recycle center is not open. honestly. And I wish we expedite that because it's really no reason for it to not be open when Waste Management has already agreed to sit down and have a discussion about it. So when are we gonna have a discussion? Is my question. Our residents don't deserve to be going through this if they don't have to. And the reason for it being shut down was not a valid enough reason for me anyway. So hopefully that'll be up and running sooner than later, and you won't have to get out and get a petition because that's our job. So thank you for that. Also about the MARTA meeting. So MARTA did come here at our to our meeting and present everything to us that they were going to be presenting to you all. So that's why I wasn't at the meeting. And then two, some of us we can't make it to everything. I would love to, but I can't. I don't, I'm sure it's the same for you guys. We all have different things going on and we just can't be at everything. But that presentation was given to us at our meeting. And also I wanted to, I couldn't remember the date, Mr. Clark, but I wanted to ask when would the applications open back up for the residents? 'Cause I know you stated that the applications are closed now.
As it currently stands, we are over the number, way over. And so now what we're doing, Ms. Paulinian and the various individuals that are serving on this committee, they are now going through and reviewing all of the applicants that were submitted. But if everybody that has applied requests the max, we're in trouble. And so they'll have to be approved on a first come, first served basis. We can only accept 120. We can only accept 120 in the program, and we are at 172.
Okay.
That is a lot.
Because we told them we was gonna open it back up.
One of the things, I think it's one of those things because that is $1.3 million. And that's only if everybody applies for the maximum of $10,000.
Thank you for that. And then tomorrow, Wellness with Wales. If you have not been to a Wellness with Wales, then I advise that you come because we have a great time. And I have lost 9 pounds since I started. And on the 27th, which was supposed to be the last one, until the next session, we've extended it. Thank you all. Well, I don't know if y'all voted on it, but supporting it, whatever. To June. And so on the 27th, which was supposed to be the last one, we'll have Miss Erica Dixon from Love and Hip Hop. She will be joining us. She's on a weight loss journey. I don't know why, but she will be joining us at Wellness with Wales too. She's heard about it and she wants to get more involved in the community that she grew up in as well. So yeah, that's it. Thank you guys so much for coming out. I hope you have a blessed night.
Councilman Mears.
Yes, ma'am. I too want to reach out to my favorite man back there in the back, Mr. Willie. He's always here. He's steady Eddie. And if everybody was like him, we'd be full all the time. And I want to throw my shout out to Mr. Abraham for the job you've done and appreciate all the help you've given the city and everybody involved. Thank everybody for coming.
All right, thank you. I want to thank everyone for coming out as well. I want to encourage everyone to come out to the play this Sunday. When I heard about it, I got goosebumps, and it's very exciting. And the play on February 20. No, so your play is Friday. Your exhibit is Friday the 23rd at 5:30, and then the play on Sunday at Paradise. Yes, both will be very riveting. You will be very pleased. And then also Trey Productions. I don't know if everyone's familiar with Trey and his theater that he has here in Forest Park. He is hiring interns for this summer. And so we'll make sure we have the information accessible if you know of anyone interested. And these are paid interns, and the people of interest must have a particular affinity and interest in theater. So, and I'll be speaking on February 28th in College Park. I think that information is floating around in cyberspace somewhere, so you guys could come on out. I think it's in College Park, and I think that is it for this evening. So with that, is there a motion to adjourn?
So move.
That was Councilman Mears. Is there a second? That was Councilwoman Wells. All in favor?
All right.
All right, thank you.